Today's presentation is on diagnosis and management of common intoxications in small ruminants. So, what is the important to talk about this topic? Because intoxications or toxins or poisons are very difficult to identify when animal is presented with the clinical signs because there is a lack of pen-side diagnostic test. All other diseases we have some diagnostic modality so that we can able to diagnose, but toxicity is concerned, we are lacking the proper diagnostic protocol or apt diagnostic test, mainly regarding plant poisons. Till now we don't have any diagnostic modality. We are mainly depends upon the history from the owner, because these toxicities are exhibited by the animal whenever it is going into the grazing land. For example, the owner is sprayed a herbicide into the area where animal is allowed to graze unknowingly by the nearby farmer. Immediately, suppose animal is developing clinical sign, all other around that area, they will tell the area is sprayed with the herbicide. So immediately owner will be bringing the animal to you. Definitely, he will say the history of animal is eaten the herbicide injected plants. He may not be telling which herbicide, but definitely he will tell the plant herbicide poisoning is there in the animal. And whenever animal is allowed for a grazing in a land, animal will develop clinical signs of intoxication immediately within 60 minutes, or it may take around 2 hours. But owner again will be telling a clear clinical signs that animal while going to the grazing, it is hale and healthy, but while coming back from the grazing land, it is exhibiting clinical signs. So it means that animal is eaten something in the grazing land, which will give you a tentative idea that animal is intoxicated with some plant toxins, or some other toxins may be available in that land. Or animal is coming with a sudden swelling of eyelids or face or brisket region. Again, owner is telling that area is bushy. There may be animal is bitten with some other venomous snakes like that. So we are here, toxin is concerned, we are relying on the owner history, and then the diagnostics at some points, and clinical signs exhibited by the animal. All the three will give you some evidence to diagnose the thing. And to get success in the intoxications or treating the intoxications, we need to recognize the clinical signs very early. So early recognition of clinical signs is very important. We should act very swiftly and sharply and quickly, because timely intervention with quick time span will save the animal with the proper antidote. So some of the toxins antidotes are available, but some of the poisons or toxin antidotes are not available. Where antidotes are not available, we are depending on the supportive care. Where antidotes are available, we should be very careful. We should always have some of the antidotes of commonly presenting intoxications. So that is very important to get a good success rate in case of poisoning or intoxications. So the content of today's topics is, first one is thiominase toxicosis. Everyone knows in day-to-day practice, you will be treating the cases of thiominase toxicity. Then HCN poisoning, followed by nitrate and nitrite poisoning. Among the herbicide toxicosis, I am going to deal only about carbamate and OPC, because I have some hold and we are treating many cases of carbamate and OPC toxicosis in our clinical setup. And next one is plant poisoning, which is more and presented very frequently to our clinic. That is Lantana camera toxicity, and then Parthenium toxicosis and ergotism. These three are very much important to admit and treat the cases. And then snake envenomation. Here everyone have a hold and hope that they can able to diagnose and treat the case of snake envenomation successfully. And copper toxicosis. Why I have given copper toxicosis here is 3 years back, we have treated a flock of sheep affected with copper toxicosis. And earlier stage, we don't know that is a copper toxicosis. We have intervened the case as infectious disease like leptospirosis or HPD like babesiosis. But while going depth, no, the whole flock is affected. Then lastly, we have arrived a conclusion that the case is copper toxicosis, though, so I have included that also here. So now we will move on one by one. First one is thiaminase toxicosis. So thiaminase is a toxic enzyme which is present in the ferns and fern-like substances or fern-like plants, which is very huge in hilly areas all around Tamil Nadu and India. Apart from fern-like plants such as horsetail and nardo, also plants which have more amount of thiaminase, which will cause thiamine depletion in the animal body, because high amount of thiaminase when taken by the animal, which will catalyze and decompose the thiamine present in the animal body. Mostly the sheep cases are presented were eaten with fern-like substances, that is Chilanthus species. Why thiamine is so much important? Because thiamine is the cofactor for ATP production, and for glucose metabolism of the brain, thiamine is much needed. And energy metabolism, thiamine is the main source, and neurological functioning, thiamine is a very important vitamin. Rumen microflora can able to synthesis thiamine by itself. Healthy rumen microflora can able to synthesis thiamine by itself. That's why thiamine deficiency is very rare in ruminants, unless otherwise the rumen microflora is affected. For example, the day to day we are treating cases of acidosis. So acidosis is because of high intake of grain diet, we all know. So when animal takes more amount of grain diet, there will be a acidosis. No, acidosis leads to altered microflora of the rumen. So altered rumen microflora will lead to high growth of gram-positive bacteria. So those gram-positive bacteria will produce more amount of thiaminase. So thiaminase will lead to depletion of thiamine. That's why acidosis cases, we are giving thiamine as a supplement. Hence, since rumen microflora are not able to synthesis thiamine by its own, so it needs to be supplemented. So this thiamine toxicosis not only occurs because of plants, but also because of altered rumen microflora, because of more amount of gram-positive bacteria in the rumen. And we need to differentiate between the polio. Whenever I am speaking with thiaminase, everyone will think about the term polioencephalomalacia. So what is the difference between polioencephalomalacia and thiamine toxicosis? So polioencephalomalacia occurs mainly because of thiamine deficiency, vitamin B1 deficiency, which in turn leads to necrosis of the cortical area of the brain. Whereas thiamine intoxication is because of a high amount of thiaminase enzyme. The thiaminase enzyme is degrading the thiamine present in the animal body. So both will exhibit same kind of clinical signs, but why we need to know which the case is because of PEM or because of thiamine intoxication? Because, so if the case is because of PEM, we need to supplement thiamine, that is enough. Suppose the case is because of thiamine intoxication, we need to identify the plant which is causing more amount of thiamine intoxication. We need to prevent the animal grazing those plants. So that is very important. That's why we need to differentiate both the condition. So, but both the conditions will respond to thiamine. So thiamine is a very important vitamin to be supplemented when animal presented with thiamine intoxication. Animal will show the clinical signs of acute form or chronic form. In case of acute form, dyspnea, depression, recumbency, and death is very common. In case of chronic syndrome, it is indistinguishable from the PEM. Animal will be showing the clinical signs similar to that of PEM, that is head pressing, stargazing, uncoordinated gait, and walking very slowly, unresponsive to the external stimuli. And these thiaminase or thiamine deficiency will affect the cortical area of the brain, where optic nerves are there. So the blindness is also common. To diagnose the thiamine deficiency, we can check eye. So there is a loss of Menas reflex, whereas the PLR is present. It indicates animal is having thiamine deficiency. It may be because of thiaminase intoxication or pure thiamine deficiency. So this is the case presented to our clinic with the signs of recumbency, unable to get up, the coordination is not proper. And recommency was there when we are making the animal to stand, it cannot able to walk properly. But after treatment with thiamine, animal can able to walk properly. The gait, everything is become normal. So this is a case of thiamine is toxicosis. The owner reported that after animal is going into the grazing land, it is presented with the clinical signs. So the treatment is very important, and dose rate of thiamine is very important. We need to administer thiamine at the dose rate of 10 mg per kg intravascular. So because rapid administration and quick administration will helps to reverse the condition. We need to act swiftly after seeing the clinical signs. Immediately we need to go into the treatment protocol. First IV injection, then followed by IM injection should be given at the dose rate of 5 to 10 mg per kg intramuscular every 12 hours for 3 to 5 days course. And we need to remove the dietary source of thiaminase, which is very important. And another one very important differential diagnosis, recently we are encountering a case of Astrologus or Oxytropis poisoning, that is commonly called as locoweed. So which is showing the clinical signs, which is very similar to thiaminase intoxicosis or even PEM. So animal showing the clinical signs of staggering gait, tremors, head pressing, incoordination, and animal is showing unresponsive to the external stimuli. Animal is showing the abnormal chewing movements. So, and depression also very common. Those cases, if you are treating with the thiamine alone, it won't respond properly. So we have to give supportive therapy. There is no antidote for these Astrologus or Oxytropis poisoning. So we need to give supportive therapy. Apart from thiamine, we need to supplement even mecobalamin, nerve stimulant, and fluid therapy. High quality, high energy, and high protein diet is very important. And we need to remove the grazing area. If we are suspecting for locoweed poisoning, we need to remove the pasture land. We have to change it. Usually, any kind of poisoning we are suspecting, we are advising the owner not allow the animal for grazing for minimum 3 subsequent days, so that it is the recovery is very quick, and the signs of recovery also will be there. So this is very important. And the next important one is cyanide poisoning, HCN. This is very common in Tamil Nadu. I think everywhere it is common. The sorghum or sorghum bicolor or sorghum sudanense is a common cause for cyanide poisoning in southern states and even northern state also. Tapioca is concerned, it is locally called as cassava. It is common in Tamil Nadu and Kerala, maybe part of Andhra it might be there. These poisonings are common in our area. Whenever animal is in dry, the plant is very much dry or drought condition. So that time those cyanogenic glycoside levels will be more in that plant. Those plant when fed to the animal will be intoxicated because of cyanide present in that plant. Tapioca is concerned, raw leaves of tapioca is poisonous. So we need to process it before feeding to the animal. Apart from this tapioca and sorghum, linseed, we all know flax. This is common in Madhya Pradesh, Uttar Pradesh, and part of Tamil Nadu also. It is having a linamarin, a cyanogenic glycoside, which is having more amount of cyanide. It will cause cyanide toxicity. Apart from that, wild plant Kanseri dal and Datura species. Acacia. Acacia is very important, commonly called as pupil tree in Telangana, Tamil Nadu, Rajasthan, and Gujarat areas. And eucalyptus leaves also will cause cyanide poisoning in small ruminants. Animal will exhibit the clinical signs of anxiety, restlessness, opisthotonus, and muscle tremor. Respiratory signs are concerned, gasping, dyspnea, and distress in respiration. Bloating we are observing. Bloating is the common clinical sign along with salivation and almond odor from the breath or rumen fluid. We are observing so many cases in case of cyanide poisoning. And brick red mucous membrane because of oxyhemoglobin and irregular pulse tachycardia will be encountered. This case presented to our clinic with the clinical sign of bright red mucous membrane. You can able to see bilaterally distended abdomen, respiratory distress, and salivation. So this animal is presented to our clinic with the history of eating HCN containing plant, that is sorghum. And this animal presented to our clinic with the history of eating tapioca or cassava. Animal presented with sternal recumbency, respiratory distress is there, moaning is there, animal unable to respirate properly, tachycardia was there, and bilateral abdominal distension, pupil dilatation. So these are all the signs we have observed in those animals. So all the animal presented with HCN poisoning shows respiratory distress, bilaterally distended abdomen, tachycardia. These are all the clinical signs we have seen in cyanide poisoning. Diagnosis is concerned nitroprusic acid test, that is a qualitative test. We have to take suspected sample, that is rumen fluid. Then a few drops of sodium thiosulfate should be added to that. In above that, we need to add a few drops of sodium nitroprusside solution. The solution color changes into purple or red, which indicate positive for cyanide toxicity. Any poisoning condition, we need to identify or differentially diagnose it from the other poisons. For example, HCN is concerned, the mucous membrane is brick red, whereas nitrate or nitrite poisoning is concerned because of methemoglobin, the mucous membrane is chocolate brown in color. And OPC poisoning, there will be more of salivation, convulsion, and respiratory distress. Whereas PEM or thymidase intoxication, there will be blindness, head pressing, and absence of menace. Stargazing will be there. Any one of the clinical signs you will be observing, and nystagmus also will be there in most of the cases of thymidase intoxication or PEM. So differential diagnosis is very important to identify a kind of poisoning. Treatment is concerned sodium nitrate and sodium thiosulfate as our textbook says. But practically, we are using only sodium thiosulfate at the dose rate of 500 milligram per kg. For example, animal is weighing 30 kg body weight. We are giving 30 to 40 ml of 20% solution. 20 kg body weight animal, 10 gram of sodium thiosulfate in 50 ml of normal saline we are mixing and giving. Apart from that, if symptom persist, we need to treat the case after 2 hours with the same protocol, with same therapy. Respiratory distress is there. We need to give oxygen supplementation. And activated charcoal, we all know that is a universal antidote that should be given at the dose rate of 1 gram per kg body weight orally. Rumen lavage with sodium thiosulfate also can be done at the dose rate of 30 gram of sodium thiosulfate, which should be dissolved in 1 liter of water. And this is the animal presented before clinical sign. Animal is on sterile recumbency with bilaterally distended abdomen. After treatment, animal can able to walk, urinate, and then heart rate also became normal. And this is the next case, which is presented with cyanide poisoning. You can able to see animal posture itself, it's not correct, and bilaterally bloated abdomen was there, salivation and incoordinated gait was observed. Then after treatment, animal can able to stand normally, and bloat was reduced and no salivation. And within 30 minutes, you can observe excellent results once you have identified the cyanide poisoning and treated with apt drug, that is sodium thiosulfate with the proper dose. And how to avoid toxicity. The hungry animal, usually the animal which are very hungry is will fastly go and eat the toxic plants. So animal should not be allowed to graze in the toxic land. That too, hungry animal should not be allowed to graze. And the plants which are chronically drought stressed, those plants will have more amount of cyanogenic glycosides. And the immature plants, the plant should be grown up to flowering stage or attain the height of 75 centimeter or above should be allowed to grazed by the animal. If immature plants having more amount of cyanogenic glycosides and wilted plants and frost bitten plants and the plants which are growing very fast and attain a stage of retarded growth, those plants should not be allowed to be grazed because those plants are having more amount of cyanogenic glycosides. So, and if the plants are having more amount of cyanogenic glycoside, that is drought resistant, drought stressed plants, no, those plants should not be used as a fodder making. So for hay making, those plants should not be used because those plants are potentially toxic. Even then it is dried or made as a hay, the toxic substance won't be get reduced. So the level of toxic substance will be there in the plant itself. So those plants should not be used as a fodder to the animal. That is very important. And next important one is nitrate and nitrite poisoning. Whenever the nitrate is taken by the animal, the rumen microbes convert nitrate into nitrite. Nitrate is more toxic, and which will transfer oxidize the heme ion from ferrous to ferric state. So there will be a formation of methemoglobin, and nitrate also act as a vasodilators. Because of methemoglobin, there will be a hypoxia, and because of vasodilatation, there will be a peripheral circulatory failure. So eventually there will be a hypoxia and respiratory compromise will be there in those animals. Where animal will get these nitrates? The area where animal is grazed near the sewage dumps. And in rainy season, even the animals are in our farmland. If the manure pit is there, so when rainwater crosses the manure pit, it is carrying the nitrate substances into the land. When those land the plants are grown, it is having more amount of nitrate. When those nitrates eaten by the animal will exhibit the signs of nitrate toxicity. Apart from that, bore well, no, it is going so deep, which may contain more amount of nitrate. And commercial manure, fertilizers, which is having more amount of nitrate, when it is dressed up, when animal eating those plants, there may be chance of getting nitrate toxicity. So when animal presented with nitrate toxicity will be exhibiting the clinical signs of weakness, depression, respiratory distress, and animal will show cyanotic mucous membrane because of methemoglobin, ataxia, tremors, and terminal convulsions also common. So we need to encounter these cases very quickly. Owner will be telling you a right history, there no doubt in that. Diagnosis also there, nitroprusic acid test. The suspected sample and 1 to 2 drops of glacial acetic acid with few drops of nitroprusside solution should be added. The solution color will be changed into orange or reddish in color, which indicates the positive for nitroprusside test. Apart from that, picric acid paper test is there. So 0.1 to 1 gram of picric acid, 1% of picric acid solution should be prepared in the dark environment, which should be allowed so away from the sunlight. In that picric acid solution, Wattman size number 1 paper should be cut in the size of 10 to 15 centimeters. Then it should be dipped in the picric acid solution. Then it should be dried in the dark area only. After that, we can save those papers. It can be used for 6 weeks, which should be airtight. It should be saved in the dark, placed in the dark area, and it should be placed in the airtight container. Whenever suspected case of nitrate poisoning is coming, you have to take the sample, that is rumen fluid, into the test tube, and over that picric acid paper should be kept, and the picric acid paper should not touch the fluid because we need only fumes to be touched the paper. And test tube should be air tightened with carb. After that, we should boil. So those fumes will go and change the color of picric acid paper from yellow to orange or mild reddish in color, which indicate positive for picric nitrate poisoning. And diphenylamine test is there. So diphenylamine reagent, that is a 0.5 gram of diphenylamine with concentrated sulfuric acid should be taken. So these solutions should be prepared and kept in the amber color bottle. Whenever suspected case of nitrate poisoning is coming on, or the plant which is suspected for nitrate toxicity, you can dip a part of stem into that solution. That will be turning the color of purple, which indicates positive for nitrate toxicity. So treatment for nitrate toxicity is methylene blue. Methylene blue should be given at the dose rate of 1 to 2 milligram per kg body weight intravenously at 1 to 2% solution. Depends upon the toxicity, you can give at the dose rate of even 10 milligram per kg body weight. And very important and my interest, no, we have treated more cases of carbamate and OPC poisoning in our clinical setting. There are over 200 herbicides are available. Even then, more common toxicity is carbamate and OPC. So carbamate and OPC toxicities will exhibit same kind of clinical signs, but the severity of clinical signs are more in case of OPC poisoning. Salivation, lacrimation, urination, defecation, meiosis, muscle tremor, weakness, ataxia, and respiratory distress is common in both the cases. Whereas instead of muscle tremors, in case of OPC poisoning, we will be observing muscle fasciculations. And carbamate poisoning, it will cause reversible inhibition with acetylcholinesterase. So it is very easy to treat. Sometimes if the poison is taken very lesser amount, animal will cure by itself. And the clinical signs also will exhibit very quickly in case of carbamate toxicity. Whereas in OPC, the toxicity is the binding is irreversible. So animal will exhibit the clinical signs very slowly. Both the cases we can treat with atropine at the dose rate of 0.2 to 0.5 mg per kg. But atropine, when given, carbamate toxicity will have quick response, whereas OPC will have a partial response, or it will take a long time to respond. Suppose animal is presented very quickly, oxines are very good. That is paraldoxine 2-PAM. It is very good because it will go and bind with acetylcholinesterase so that these OPC compound don't have place to bind it. So reversible is possible if animal is presented very early and we know that proper history that animal is ingested with OPC compounds. If that is there, we can go with 2-PAM instead of atropine. That is the thing. And the source for carbamate poisoning are carbaryl, aldicorp, and methomyl. Whereas in OPC are malathion, parathion, and chlorpyrifos. So this is the animal presented to our clinic with the history of carbamate ingestion. So you can able to see the vertical nystagmus and muscle tremors in the neck. Immediately we have given the treatment of atropine. So animal is responded and urinated well and it can able to walk properly. So this is how if you are identifying a particular case as a particular toxins very correctly, if you are giving a right antidote at right time, you will be getting a nice recovery. Owner also will be happy. So the line of treatment for both carbamate and OPC poisoning is atropine. The dose rate of atropine is very much important because as a pre-anesthetic, the dose rate is very less, 0.02 milligram per kg, whereas antitoxin, the dose is 0.2 to 0.5 mg per kg body weight, intravascular. Sometimes depends upon the nature of toxicity, we will give half of the dose as intravascular and half of the dose as intramuscular. And subsequent doses we will give subcutaneous also. So it all depends upon the clinician who is seeing and treating the case. The actual dose is 0.2 to 0.5 milligram, depends on the toxicity. You have to give intravascular, that is very important mandate. And these dose should be repeated every 2 to 6 hours until the clinical signs are reduced or vanished. You can give universal antidote activated charcoal at the dose rate of 1 gram per kg per hour. And to dilute the toxins, you can give in IV fluids. If animal is dehydrated, that also should be monitored. IV fluids are important. And antioxidants also important. You can give vitamin A, D3 like that, antioxidants. And the animal is exhibiting the signs of respiratory distress, it is important to give oxygen therapy. But those cases usually no necessitate oxygen therapy. Till now, we have not given oxygen therapy to those cases. We have treated with atropine. Animal is responding very well. And if suppose animal is having excessive tremors and seizures, so it is important or it is our duty to reduce the tremors. Those cases we can use diazepam at the dose rate of 0.2 to 0.5 mg per kg intravascularly. 2-PAM is concerned, which is indicated only for OPC poisoning if animal is presented within 24 hours of poisoning. So after 24 hours, every binding site is blocked. If you are giving 2-PAM also, no use. Better to go with atropine only. The dose rate of 2-PAM is 20 to 50 milligram per kg body weight intravascular. And next very important thing is lantana camera plant poisoning. Photosensitization. We all know photosensitization is very common. There are direct photosensitization causing plants are there, and hepatogenous toxicity causing plants, that is a secondary photosensitization. And then genetically, some of the animals are having phototoxicity. So the lantana camera is concerned, it is coming in the second part, that is hepatogenous photosensitization it will cause. These lantana camera, when eaten by the animal, it will go and affect the liver. So liver cannot able to excrete the photosensitizing substances, which will accumulate in the body, which will cause the clinical signs. So phytoerythrin is the breakdown product of chlorophyll, which is excreted through the bile from the alimentary tract. Whenever hepatic insufficiency or biliary insufficiency is there, it cannot able to work properly. So excretion of these substances are retarded. So which will leads to photosensitization. Those photosensitizing substances, it penetrate when light is penetrated, which sensitize the tissue. So these substances will be accumulating on the skin. So it will cause, when sunlight is entered into the body, it will cause local cell death and tissue edema. Animal will be showing intense irritation, followed by necrosis and gangrene and sloughing of the skin even. The sloughing off will be there in the terminal stage of the disease. Usually it will affect, we all know, it will affect unpigmented part of the skin. It will cause erythema, swelling of the muscle area, nasal and ocular discharge, and local edema will lead to drooping of the ears and closing of the eyelid, and nostrils also closed. So there will be a dyspnea. And then swelling of lips will cause dysphagia. And because of intense irritation, animal will show the behavioral signs, that is restlessness, intense itching, rubbing, and then scratching movements. So this is the animal presented to our clinic with the clinical signs. You see the unpigmented area, that white skin part, you can able to see slough of the skin. Here also it is closed view, and here you see nostril area. There is a slough of the skin and mild edema was noticed. It is the typical clinical sign for lantana camera poisoning. The best way is you have to keep away animal from the sunlight, and you have to avoid further toxicosis. Owner should be properly advised, not allowed the animal for grazing, and tie the animal in the shaded area. Animal should not be allowed to expose the sunlight, which will aggravate the condition. And to expel the toxin, we can use laxatives. And to avoid, to reduce the swelling and pain, irritation signs, we can use the NSAIDs or steroids. To reduce itching, we can add up with chlorpheniramine maleate. All are symptomatic treatment, which will give effective cure. And next, and the important one is Parthenium toxicity. So Parthenium toxicity, Parthenium is, we all very know, everywhere we turn, we can see the plant Parthenium. So wherever we can see the plant with the yellowish flower. It's like a carrot flower. So that is Parthenium. So when animal is injecting low level of plant, that is 1 or 2 are browsing there, it won't cause much affection. It will only show the gastrointestinal signs, that is diarrhea, sometimes ulceration of the mouth, and dermatological signs, itching, and it also affects liver and kidney. So whenever you are seeing blood values, there will be a liver damage and nephrotoxicity also there. Some of the animal will show the signs of respiratory, that is coughing, difficulty in breathing, and nasal discharge. But here in our clinical setup, we encountered a case of neurological signs. The animal will show depression, incoordination, weakness. So these are all the animal presented to our clinic for past 1 year. We have get 3 cases of Parthenium toxicity, which is exhibiting the neurological signs. It cannot able to get up, even cannot able to lie down in the sternal recumbency. It is exhibiting incoordinated gait, and pain also observed in the animal. We have treated with universal antidote, that is activated charcoal, and we have given symptomatic treatment, but we are unable to make the animal alive. It animal is gone. So the management is concerned. Early recognition is very important. Once the neurological signs observed, it is a little difficult to treat Parthenium toxicity. Activated charcoal can be used as a universal antidote at the dose rate of 1 to 2 gram per kg orally. It will absorb the toxins. Apart from that, symptomatically, antihistamines, anti-inflammatory drugs can be used, and intravenous fluid therapy, and to reduce the oxidative stress, vitamin AD3 and selenium can be used. It will affect liver, so liver protectants, silimarin can be used. Apart from that, high quality forage fodder should be used. But it is very difficult to treat one certain neurological signs. And another foremost very important thing is ergotism, ergot toxicity. It is because of ergot alkaloids. So ergot is a fungus that is Claviceps purpurea. It is having the toxin, most toxic ergot alkaloids. So when ergot infected plant, that is grasses or fodder, are ingested by the animal, which will cause ergot toxicity. So the cereal grains like paddy. So here in this image you see the black color discoloration of the grain is because of ergot poisoning, intoxication of ergot fungus. So whenever the plant is having ergot fungus, we should not feed those plants to the animal. So sometimes cereal grains like paddy, rye, wheat, and barley, oats also infected with ergot toxicity. And some of the grasses, pasture land, some of the grasses will be infected. And if we are storing grains which are improperly stored, there may be chances of ergotism in those animals. The clinical signs of ergotism are vasoconstriction. This is very important. It will cause vasoconstriction because of the narrowing of the blood vessels. There is cold extremities, swelling, and painful extremities. Mainly, these lesions will be seen in ear, tail, and hooves. It will cause dry gangrene. Most of your in your practice, definitely you will be observing the animal is having dry ears. If you are twisting the ear, it will broke. So like that it will be there. And earlier stages, there will be a swelling and sloughing of ear or extremities will be there. That is because of ergot poisoning. And some animal will show neurological issues like ataxia, incarnation also. And reproductive problem also there when the animal is injecting chronic ergot alkaloids. So this is the animal presented to our clinic with ergot poisoning. You can see necrosis, dryness of ear, and dry gangrene will be seen in this animal. Management, you have to remove the animal from the contaminated fodder or forage. If animal is showing these clinical signs, the fodder and grain should be checked, and the grassland should be checked or changed. And we have to give symptomatic therapy, supportive care, nutrition, hydration. This is very important. And whenever sloughing off like that is there, no, there may be chance of secondary bacterial infection. So you need to supplement antibiotic in those cases. So once the affected contaminated forage is removed, the animal will recover by itself. And the very important thing is snake envenomation. Snake envenomation is encountered in small ruminants, not commonly, but snake envenomation cases will be there in small ruminants. Among the snake envenomation, hemotoxic snake envenomation is very common. That is, viper envenomation is very common. This is the case presented to our clinic with brisket edema and swelling of coronet region, hoof area. So here also swelling of the jaw area and facial edema swelling is there. So these, if you are suspecting snake envenomation, that to hemotoxic snake envenomation, we need to collect blood and we need to do whole blood clotting time, 20 minutes. We need to collect the blood, and better to keep in a glass vial with open top. we have to collect blood and keep it. While collecting, we need to note the time. That is important. 10 o'clock means we need to write 10 o'clock and keep it in the white sheet. Then after 10 minutes only, we need to check. Suppose immediately 1 minute, if you are checking, there may be fibrinolysis, definitely the blood won't clot. So to arrive a conclusive diagnosis, you need to check the blood once after collecting. After 10 minutes only, we need to check. Within 20 minutes, the blood should be clotted. If it is not clotted, which indicates that animal is having snake envenomation. And suppose if you are using syringe, when collecting syringe only, this part of syringe will be blocked with blood clots. So there will be, it will be preventing the entry of air inside. So there may be delaying in the blood clot, normal clotting time. So those should be avoided. Always there will be a gap in the hub for the entry of air. So air is not entered, there may be chances of improper blood clotting that should be avoided if you are using whole blood clotting time. So if animal is suspected for snake bite, only local swelling, pain or necrotic wound, discharge or punctured wound is there, you can treat. That will be easily cured because the only signs are local. Suppose systemic signs are there. In case of neurotoxic snake envenomation, it is difficult to treat. Respiratory failure and difficult in swallowing, animal will leads to death. In case of viper intoxication also, there will be bleeding gums. If severe toxication is there, systemic, it enter into systemic signs, no? Bleeding gums, nose, and bleeding occurs through rectum also because of coagulopathy. And dark color urine, and then animal will be dying very quickly. Shock and death will be there. You cannot able to save the animal. So management is concerned. We need to give polyvalent anti-snake venom. Then the quantum of polyvalent anti-snake venom is very much important because the anti-snake venom is depends upon the amount of toxin ingested by the snake into the animal. So the clinician, based on the clinical signs exhibited by the animal and the type of the snake bite, he has to decide how much quantum of anti-venom should be infused. That is very important because the amount of venom, if injected more, also will cause kidney damage. If it is less also, again, animal won't be survived. So that is important. And fluid therapy to dilute the toxin and to eliminate it is very important, and to make the animal hydrated is very important. Furosemide to eliminate the toxicity, and NSAIDs to reduce the pain sensation, and antibiotics to avoid secondary bacterial infection because the snakes having more amount of Clostridium organism in the snake's mouth. And TT injection is also very important. So these are all the protocol we need to follow while snake envenomation case is presented to us. Copper toxicosis, as I told earlier, why I have taken this topic is copper toxicosis will mimic, it is rare toxicosis. It will mimic the clinical signs of leptospirosis and babesiosis because chronic copper toxicosis will affect liver. So liver damage will lead to icteric changes in the all the mucous membrane, CMM and vaginal mucous membrane, pineal mucous membrane. Everywhere it is icteric changes will be there, and it will affect the hemopoietic system, and bloody urine will be there. Hematuria will be there. So the clinical signs will be confusing. So we are all field veterinarians or clinicians. We will be thinking about infectious diseases first. So we won't be thinking about toxicosis. Copper toxicosis is concerned, owner also won't tell proper history. So when 4 years back, a flock of sheep presented to us with the clinical signs of icteric mucous membrane and hematuria. We all thought that animal is having hemoprotozoan disease. No, first treated for hemoprotozoan disease. Animal is not recovered. Then we have go into their place and check for the feed and all. We checked for rat-related leptospirosis. Then there also we failed, and one by one the flock of animals are dying. Then from the dead animal, we have taken a sample of kidney and liver, sent for toxicological analysis, from where we got a conclusion that animal is having copper toxicosis. Then we have went for a retrospective study why the copper toxicosis was occurred in that particular farm, because the owner is giving a mineral mixture for a couple of years with the same dose rate to all the animals. So for a course of time, the coppers got accumulated in the body. It become a toxicosis. So apart from those cases, because of mineral mixture toxicosis, I have identified. Then apart from mineral mixture, there are agricultural chemicals and copper-rich soils and pharmaceuticals, pasture lands contaminated with the industrial effluents, which is having more amount of copper, and copper are fungicides used for agricultural lands, which are all toxic for the animals, which will cause copper toxicosis. There may be acute copper toxicosis, which will cause fatal shock and death and GI mucosa necrosis, whereas chronic copper toxicosis, it will cause hepatic necrosis and hemolytic anemia. So in case of acute, we need to give supportive therapy that is symptomatic, whereas in chronic, we need to give chelating agents. In case of acute, we have to give more amount of fluid therapy and GI protectants, NSAIDs if shock is there, and hemolysis is there, we need to go for blood transfusion. Chronic toxicity is concerned D-penicillamine at the dose rate of 50 mg per kg and dimercaprol calcium disodium EDTA. And in case of lambs or goats, we need to give ammonium molybdate and 1 gram of anhydrous sodium thiosulfate as a binder, which will avoid further toxicosis. So we are coming into the conclusion of this particular topic. From this lecture, that is diagnosis and management of common intoxication in small ruminants, these are all the points you have to remember. So in case of you are suspecting the thiaminase toxicosis, you have to give thiamine at the dose rate of 10 mg per kg. If you are suspecting cyanide poisoning, you have to give sodium thiosulfate at the dose rate of 500 mg per kg. If you are suspecting nitrate and nitrite, there are tests to confirm. You have to give methylene blue at the dose rate of 1 to 2 mg per kg. You can go up to 10 mg per kg also. In case of carbamate and OPC, atropine is the drug of choice at the dose rate of 0.2 to 0.5 mg per kg IV. In case of OPC, if presented earlier, we know it is OPC poisoning, then we can go with 2 PAM. And in case of plant toxicosis, there won't be a proper antidote. We have to remove the source and we have to give supplements, liver protectants, and hydration and elimination of toxin with the help of laxative is important. Snake envenomation is concerned, polyvalent anti-snake venom along with supportive care. Copper toxicosis, chelating agents, and supportive care is very much important. And take-home points from the present study is we need to diagnose any toxicosis very quickly, and early intervention is very much crucial. And IV therapy with proper antitoxins are mandatory. We need to act very rapidly. Chelating agents and detoxifying agents are available. We need to treat with that. That is important. Sodium thiosulfate, methylene blue, and other chelating agents for copper is a key for poisoning, for heavy metal poisoning and all. Supportive care with fluids, hydration is very important. Pain management, liver protectants are very important alongside with the specific antidotes. And as prevention is better than cure, we all know. So identify and remove the toxic source is very important to prevent the disease. So thank you, one and all.